So in the last class, we have done the discussion of this triangular fossa, and we told we can see this pit. This pit is called triangular fossa because it looked like triangle. So it is looking like triangle. So that's why we have given the name triangular fossa. So then we have divided this triangular fossa in many parts. We have divided in 3 parts, and we told this: heaven, human, and earth. Heaven is connected with the brain and heart. Human is connected with the middle part like liver, and earth is connected with the reproductive part. So that's why in the heaven, in this upper part, we have tranquilizer point, or the point which is directly connected with brain and heart. So that is called tranquilizer point, means Shenman. In the middle part, we have liver point or point of hepatitis. And this part is connected with all the acute allergies as well as chronic allergies. And lower part is connected with the reproductive functions like uterus in the female and prostate in the male. So in these 3 parts, if we talk about this heaven, we further did 2 division. So upper part is Shenman. Lower part is hip area. Then this middle part or human, we have divided in 3 parts. This upper part is connected with the liver and hepatitis. Middle part is connected with the allergies. So that point has been told, the point of antihistamine. Antihistamine. What is antihistamine? Antihistamine like a inhaler. All the asthma patient, all the patients suffering with breathing disorders, they are using pump or inhaler. That phlegm, that gas, that is having antihistaminic effect. So as soon as you take this, dilate the bronchi. So this is the point. This is called antihistamine, as well as beijing point. Beijing means the sound like a whistle coming from the lungs while breathing. So ultimately this is connected with the lungs as well. The lowermost part, this is connected with the groin as well as constipation. The most effect we have seen in the groin pain. So we have done the discussion that groin is this area in the legs. Sometimes we feel pain this side here. So if this is the legs, these are the two legs. So this is groin area. So sometimes we feel pain here. So this is called groin in the legs. Then ultimately we reach to this uppermost part. We further divide in three parts. This part is connected with the blood pressure. So the point of high BP. And the center point is connected with the uterus in the female. Uterus in the female and prostate in the male. So this was our discussion in the previous class. So this triangular fossa can be divided in 8 parts. One, two, three, four, five, 6, 7, and 8. So point number 1 is a Shanman or the point of tranquilizer. Point number 2, hip joint. So these 2 points are coming in the upper part. Now discussing this middle part. Point number 3 is a point of liver or and hepatitis. 4, antihistamine or beijing sound. So connected with the asthma attacks. And point 5 is the groin and constipation. Then this middle part is completed. Then we'll talk about the point number 6 is the high BP. So when we put this point, it will reduce blood pressure. Then point number 7, the point of uterus in the female and prostate in the male. So let's see the practical demonstration. So first so when we do the practical demonstration, most of the people are doing mistakes because we have seen our auricular workshops. Even we tell exactly. Then also people are doing mistakes. Participants are doing mistake. What mistake they are doing? The very common mistakes done. That is because we are talking about the fossa or pit, and we know this is the triangular fossa. and this is the antihelix. So mistake number one, we are crossing the triangular fossa and putting the point in the antihelix. This is the mistake number one. Mistake number two, triangular fossa is this much till this extent, and this part is hidden. This much part is hidden, and this part is hide because of this helix is little coming up. So because of this part is hidden, so just we are considering this much part only, and we are trying to put all the needle in this blue part only. That's it. We consider this is a triangular fossa. We forget this black part because this is hidden. So we have to focus in these two mistakes. Number one, kindly we in the fossa do not go on antihelix. Point number two, C, complete fossa. Do not leave the part who is hidden inside. Third, be careful that we have to put the needle slanting here. Slanting means with the 50-degree angle. Fourth mistake we are doing, which is very common mistakes, and which we do only in the initial stage. That is also very common mistakes. Like we have divided in three parts, and I told this upper is Shanman or TF1. So we are forgetting this and we are putting the Shanman down in this part. We are subdividing correctly, but we are forgetting, and by mistake, we are putting the Shanman down. That is the hip point, not Shanman. So these are the common mistakes has been done. Other things is okay and simple. This triangular fossa looks like very simple, but having greater effects, greater results. So all of you put the seeds, put the needle, and send the images in the group after whenever you practice this, so that I can correct your location, so that we can learn everything very perfectly. So let's see the ear. So triangular fossa, we can see this triangle shaped. This is the triangular fossa. So we can divide first triangular fossa in three parts. Upper part, that is heaven, that is human, and innermost part, that is earth. This part. So this is heaven, this is human, and this is earth, inner hidden part. So let's talk about the heaven first. So if we divide this heaven with this horizontal line, so on the horizontal line, one side is heaven, other side we have the location of human and earth. And uppermost point If we further divide this heaven in two equal parts, then uppermost point is Shanman and lower point is hip joint. Shanman is the point of tranquilizer. Putting the needle on the Shanman. So look at this. I have inserted needle in the Shanman. Bas. So I have inserted needle in the Shanman. We can see this is the upper part. And if I go down, little down, so that is the hip joint. So I have put the seeds in the lower part, that is hip joint. So my needle in the upper part and seeds in the lower part. So they are point the one after another. So if I put two needles, so upper needle is Shanman and this lower needle is the hip joint. So we can see two needles. One is going in the Shanman, upper one, and down needle is going in the hip joint. So we can either put the seeds here or fenugreek seeds here. Then we'll proceed to the next. So now we are going inside. Further we have lots of area. So we will do one more division. So this is the middle part. Now in between these two lines, whatever area we have, that is liver area or human area. Upper one is heaven, middle one is human. So that area is connected with the liver. So liver means hepatitis as well as all the allergic problems like allergic asthma, and antihistamine point also will find at this middle part. So we will further divide this middle part in three subdivisions. Upper one, and lower one, because area is very small. So better to I will insert the needle. So upper one, थोड़ा ऊपर उठाना, lower one. So upper one needle in the liver point. Vestibular. नहीं आ रहा सही. थोड़ा down. Yes. Because this area is too small and needles are very closer. So upper one needle, which you can see clearly, that is hepatitis, and just down to that, that is the point of antihistamine or beijing sound, and the lowermost needle, that is groin point. So I have inserted only two needles, one in the hepatitis and lower is on the point of groin. So now on the line of liver, on the line of hepatitis, if we go inside,
Like this, mate.
Put the seeds there. That is the point. High BP, uppermost point. That is the point, high blood pressure. And just below the high blood pressure point, the lower point, that will be the point of prostate in the male. This point, the lower point. So we can see the ear image very clearly. So if we see the ear, triangular fossa, so we can see heaven and human part can be seen, but earth part is hidden inside. So that's why we sometimes we leave the earth. We don't count the earth. We just treat what part we see from the distance. Only we consider that part. We forget the inner hidden part. So we are putting the seeds or needle in only exposed part. That is a mistake. So we have to see inner hidden part as well. The inner part, who is hidden inside. That also should be under the consideration. So this upper part is a Shenman. So we can put the needle in this way, or we can put the needle in this way, or we can put the needle in this way. Shenman or tranquilizer point. The lower part is a hip. We can put in any directions. So this is the heaven. Then this is the middle, human. We have subdivided in three parts. Upper is a hepatitis, middle is a antihistamine, and lower is a groin. And at last, this is high BP, and this is uterus and prostate. So this was the finally we do once more subdivision. TF1, TF2, TF3, 4, 5, TF6, TF7, TF8. So this is the subdivision of triangular fossa. Very small area, so sometimes it is a little difficult to demonstrate. Let's proceed further. In the ear, the most important part of the ear is this. This is called TG or tragus. We have subdivided tragus in 5 parts. This whole area has been subdivided in 5 parts. 1, 2, 3, 4, and 5. So tragus 1, tragus 2, tragus 3, tragus 4, tragus 5. This tragus is a very important area of the ear. Because This is connected with lots of things which we need in our daily to daily life. So number one, think this whole tragus is representing complete spine, and explanation of this spine is coming in the different phases, because as per auricular concept we have discussed that in auricular we have many phases, phase 1, 2, 3, like that. So in some different phases, this tragus has been considered as a complete spine. And we know in the ear we have inverted spine, means cervical is down and lumbar is up. So following that sequence, if we divide this whole tragus in three equal parts, so this is cervical, this is thoracic, and this is lumbar. So just by treating the tragus, you can treat whole spine. So this area C1 to C7, this area T1 to T12, and this area L1 to L5. And at this uppermost part, we have sacrum and coccyx. So whole spine can be treated just like tragus. Cervical, thoracic, lumbar, whole spine is available in the tragus.